So this is Rita Teaotia. I am Chairperson of the Food Safety and Standards Authority of India, and we are based in Delhi. Well, look, the biggest effort that we have made is really to build partnerships with multiple stakeholders. The food sector, as you clearly know, it affects 1.35 billion Indian citizens, and with that, it's such an enormous task that it just cannot be done by the regulator themselves. It has got to be through participation and a shared responsibility with all stakeholders. So during this year, we set up a network of professionals, what we call the NetProFan. This is 6 national associations: the Indian Medical Association, the Indian Dietetics Association, Nutrition Society of India, Chefs Association, Analytical Chemists, all stakeholders in the system. And this network now has state-level chapters, and these chapters focus on spreading the message of eating right, the science of eating right, to all their stakeholders. So this is one level. Secondly, and this is really interesting, this is our partnership with for capacity building. Our food businesses also need support in order to be able to be compliant. I mean, the regulations are in place. So our FOSTAC training is a training program designed to support industries to be compliant. It's specific sector to sector, and we now have 216 FOSTAC training partners, all private sector, who now spread throughout the country and provide support to food businesses. The third thing, and this is very recent, is with consumer organizations. We call this the network of consumer organizations in food and nutrition. And these organizations, also interested in the area of food and health, have come together to work with the Food Safety Authority. They'll focus on a few areas. There is the awareness, then holding hands and strengthening the small and petty businesses and helping them to engage in various activities that we are promoting. And also some of the voluntary organizations with the capacity will support us in our surveillance work in order to ensure that food is safe and healthy. I'll give you an example of this. During the Diwali holidays, we worked with Consumer Voice in Delhi to pick up samples of milk products, that is khoya, paneer, deshi ghee. The Consumer Voice did the masking of the samples, although they were accompanied by our food officers. The samples were then sent to our central laboratory at Ghaziabad, and the outcome of these tests, which are now under completion, and the results of this surveillance is something we are going to share with all the stakeholders. But we think it's an interesting way to engage with consumer organizations, build consumer trust in the food that they eat. And so this is an important tool for us engaging with stakeholders. Finally, we are setting up a network with research organizations who will, throughout the country, in 6 key areas of our interest, including testing, the food additives and adulterants, things like that. They would do the horizon scanning and support us with the basic directions for future standard setting and research work. Well, the Eat Right India campaign is actually an overarching campaign that the Food Safety Authority has gone into. And this covers basically 3 pillars: Eat Right, and Eat Right means healthy diets, safe food, safe cooking practices. Eat Healthy looks at broad basing of the diets, eating fortified foods, and eating a diet that's low in fat, sugar and salt. And the third pillar is eating sustainably, and that focuses on local and seasonal foods, water conservation, less plastic use. Now these are three core pillars of the Eat Right. They're backed up by a substantial campaign. The first was the Swasth Bharat Yatra, which we took out late 2018, and this mobilized cyclists. It was the largest cyclothon in the world, I believe, about 21,000 cyclists who held events at 2,100 locations. And finally, this touched about 2.5 crore consumers with the message of eating right, eating healthy. I think this was one way to mobilize people around the idea of healthy diets and eating right. We also back this by consumer-facing campaigns. So we've done a Thoda Kam film with Rajkumar Rao. We've done Heart Attack Rewind, which focuses on reducing of the fats in the diet. And there are outreach tools that we use to make consumers much more aware. On the supply side, we work with the industry. And with the industry, we have now probably a large number of bakery associations, biscuit manufacturers associations who have committed to reduce the trans fats in their finished products. We have about 15 major food processing companies, Patanjali, HUL, ITC, Marico, Bikanerwala, Haldiram, all these, who have committed to redesign their processed food products to contain much less of salt, sugar and fat. We've also got food chains, again Haldiram, Bikanerwala, Jubilant Foods, who are offering healthier options on their menus and who are also adopting menu labeling. So these are all entirely voluntary initiatives that have been undertaken. I think this really, the response to this is what I already said. The entire effort of the Eat Right campaign is on the demand side, consumer facing. The effort is to reach the consumer through various campaigns, through various outreach efforts, all backed with films, national competitions for children, and initiatives through our various networks in order to raise the awareness about food safety and eating right. And on the supply side, certainly, to make sure that healthier choices are available on demand to those consumers who seek them out. Look, it's a fact that cutting across economic strata, Indians do suffer from micronutrient deficiencies. Fully 70% of Indians do suffer from such micronutrient deficiencies. We advocate a multi-pronged approach, so dietary diversification, food supplementation, biofortification, and fortification. As far as fortification is concerned, we've had discussions over years. And finally, in 2018, we came out with a regulation setting the standards for fortification of 5 staples. And these 5 staples were identified because they are common to the diets nationally. These are edible cooking oil and milk, which we have advocated fortification with vitamin A and vitamin D. Rice, wheat and wheat flour fortified with iron, folic acid and vitamin B complex, and salt double fortified with iodine and iron. So these are the 5 staples, but we've set the levels at between 30 to 50% of the recommended daily allowance to allow for dietary diversification to supply the remaining. We are also working with national programs of the ICDS, the midday meal program and the public distribution system to ensure that these key national programs which reach the most vulnerable Indians adopt fortified staples as part of the program. And for this we are working with the state governments, and already about 19 state governments are on board. They are doing it statewide or they are doing it in some districts, but they are beginning to pick up on this fortification. On the voluntary side also, about 116 products, 116 brands are now available on the market shelves. And what's really encouraging, because we have not yet mandated fortification, this is voluntary, the packaged edible oil, about 47% is now fortified, and the milk, about 37% is voluntarily fortified as per our standards. We have again a small film which advocates for food fortification, and that's been shown across social media, across the theatres, etc. We've also institutionalized the logo, +F logo, and we are popularizing that. All the food products on the supermarket shelves which are now fortified are required to bear the +F logo on the front of the pack. So this is an effort that will popularize. We also are using a lot of outreach tools to consumers to make them aware of the need to eat fortified. Well, I think that we have just one message, and that is that we need your support. All these stakeholders that you have mentioned are working with us through our various partnership programs, one or the other of our initiatives, and we do need that support in order to be able to ensure safe food and healthy diets for all Indians. There are occasionally misunderstandings and apprehensions about some of the regulations, but we urge the food businesses to actually interact with us on areas of concern, because we have been very receptive and very supportive, but fundamentally our concern and our focus is consumer well-being and health, and I believe that we are all partners in this particular effort. As far as the nutrition labeling is concerned, our labeling regulations are roughly similar to those that are as per global practice. What we are doing now is we have brought out a draft regulation on health claims. When can a food product make a health claim that a particular food achieves a certain objective, or just by the name imply that it has certain health benefits, which it may or may not have. So having a scientific foundation for health claims is something we are mandating. The other area of food labeling on which we are working is on front of pack labeling. Throughout the world, it's been observed that the nutritional labeling at the back of the pack, consumers do not understand it very well. It does not make available informed choices. So the front of pack is an effort to really bring to the attention of the consumer the total calorie count, the level of salt, sugar and fat, saturated fat in a particular pack as a percentage of the recommended daily allowance. So we have a draft notification on this, and this is also under process.